Hello, everyone, and welcome. My name is Dr. Zoe Wyatt, and it is an absolute pleasure to be here today as part of the International Conference of, on Global Healthcare. A little bit of context about me before we jump into the topic at hand. I have been working internationally in the clinical space for quite some time now. I'm originally from Melbourne, Australia. I am a licensed mental health social worker with a PhD in the area of trauma and resilience. I spent 5 years living in Southeast Asia, 4 years living in Mauritius, and have worked with clients and organizations in a clinical capacity and also conducting workshops all over the world for the last 10 plus years. So let's jump into the topic. In this session, it's specifically geared towards healthcare practitioners. And I wanted to create something that would hopefully benefit those of you that are listening to this in terms of understanding burnout, but also what are the specific challenges for healthcare professionals. A lot of this will be based in my favorite areas of both neuroscience and psychology in terms of resilience. And I'll be sharing with you many examples from across the globe to highlight some of these both challenges and strategies. To begin with, a broad definition of burnout. It is stress related. It is prolonged, ongoing stress. And what we might see and how that presents is someone feeling very detached, disengaged, not only from their work, but from their social connections in their personal life. Burnout does not just stay in one area. It might be caused by our work, but that doesn't mean that it's only going to be work related. We see people have a variety of physical stress responses, and that might be everything from headaches to nausea to indigestion. Our central nervous system, which is affected during peak times of stress, interacts with our digestive system. We might see that people's emotions become almost flatlined. They start to feel nothing when they're interacting either with patients at the front line or in their personal life. Burnout tends to remove the enjoyment. So people feel like they're just moving through tasks step by step, but they're not really present for that. What we also understand is there are contributing factors. And for those of you that are working with patients, first, there is an area of compassion fatigue, and we'll talk more about that in depth. It's when we might be carrying the emotional weight and burden of what we're seeing in our role. So that's coming up. But what we also see in a lot of emergency settings and various types of medical settings is a sense of immediacy. Someone's stress response could be activated throughout the course of the day, depending on what's in front of them. And that's very much been normalized. Now, as much as I'm not a medical doctor, I remember very distinctly working in an inpatient treatment setting in the early part of my clinical career. And it was an amazing learning experience, but it was so just supercharged. We had clients coming into treatment that required medical intervention, that in some instances were very unwell. We had relatively high caseloads. I was also doing a lot of trauma workshops and psychoeducation groups on the area of trauma. So not only was there an emotional component to this, there was stress and demands within that workplace and the speed in which we would be operating for a 10-hour period, I had never experienced before in this capacity, in this field. And it did take its toll. More on that in a moment. But workplace culture is critical, and it's not just about the external demands and stresses. How do you feel about the team around you? Is it supportive? Do you have people that you can lean back into after a particularly challenging patient or case? Or are you taking it home? And what we might see is some of those physical symptoms I mentioned before, alongside of sleep disruptions. You might be having intrusive thoughts, thinking about areas of your work when you're trying to just have a nice dinner with a family member. Other times we see it's mentioned lack of autonomy on this slide. This speaks to control. Let's say you wake up in the morning and think, right, I'm going to take on the world today and feel really in control of your work, your environment, what's expected. Now, not all days are like that, but that would demonstrate a certain level of autonomy. If you feel like you're being swept away with the tides of life in your work and you have limited control over your day-to-day activities, this lends itself to stress, which is why it's a contributing factor to burnout. What we also see is sometimes high stress, high level of intensity in terms of our work environment being very much normalized. And when you have gone through med school, done the rounds and experienced this, it's normalized from a very, very early point. And I think sometimes it makes it harder or more challenging to reach out and say, I'm not actually coping with this workload right now, or I'm finding these elements of my role I'm thinking about later at night or right before I go to bed, or I am slowing down in my thoughts and actions, which is the last point here about cognitive overload, the brain under stress. And some of you might have experienced this during high stress points in your life. You sit down to undertake some paperwork or an admin task that normally takes you 20 minutes, but it takes you an hour to complete the same task. You might have a very fuzzy feeling walking into a room thinking, what was I doing here? What did I need? And that might be sleep deprivation, but it can also be the brain under stress. And unfortunately, we tend to push ourselves harder. Okay, I'll just do overtime in order to catch up on paperwork, when in actual fact, our brain is quite literally overloaded, and the opposite is what we need. Let's have a bit more of a deep dive into some of the neurobiological elements of this. And what I was talking about before with our cognitive abilities, you can see here our prefrontal cortex, which is responsible for our emotional reasoning, understanding long-term consequences, decision making. Most of you will spend the vast portion of your day firmly implanted in your prefrontal cortex, alongside of the amygdala, which is our stress response, being activated. And other areas of our global environment speak to additional compounding stress. Some of you might have experienced downsizes, restructures within your organization, or you have stress at home, conflict with a family member, a sick parent. There are other elements that then further contribute. So, our amygdala, of course, is not just fear, it can be anger, it's fight, flight, freeze. And so, there's been some wonderful studies done on strengthening neural networks in the brain from the amygdala to the prefrontal cortex through stress relief activities such as mindfulness and meditation. Also, more on that in a moment. But what we also see is that when the hippocampus is affected by high stress, it impairs our learning and our memory. And this, of course, puts us in a deficit. When we look at some of the research that has been specifically done on burnout in the medical field, it is high risk because of the need sometimes for those of you to make those very well thought out but snap decisions in the same time. And if there is a cognitive impairment as a result of the brain, this is not a clinical term, but quite literally swimming in stress, there are poorer patient outcomes, but not to mention your emotional and physical health. You can see here as well that, of course, our stress response activates cortisol, adrenaline, and epinephrine. Now, this doesn't necessarily harm us in short, sharp bursts. Our stress response was designed for more simple times. There's a lion, fight the lion, or run really fast in the other direction. But please reflect just now, how many times in the course of an average day do you believe you might have cortisol, adrenaline, and epinephrine flooding through your body? And for those of you that are in really fast-paced emergency environments, that would be a lot. And once again, with it being normalized, we feel like, well, this is just part of the role. Yes and no, because for extended periods of cortisol, it can actually damage the neurons and interrupt our ability to emotionally regulate. And we see this. So you might be reacting well at work and you come home and you're really short and snappy with close family members. You might find that your reaction time has been delayed. You might find that you become overwhelmed and sad at something that is not on par with your normal emotional reactions. This can also be a direct correlation to cortisol levels in the body. And then dopamine. Burnout has been shown to diminish dopamine levels, and this stops us from feeling fulfilled. Think about when you first embarked on your career, and perhaps, I don't want to say all of you, but perhaps a lot of you were feeling really uh, engaged. I'm going to save lives today, and excited about that. And nothing's stopped. You're still saving lives, but you might not necessarily feel that way. Or you might not necessarily have the same level of enjoyment if you're just feeling like you're moving from point A to point B throughout the course of the day and trying not to drop the ball. This is often a sign of low dopamine caused by hormones and neurotransmitters in the brain. Now, I mentioned compassion fatigue. The symptoms are very similar to burnout. And on the next slide, we'll talk about what is the difference, because you can see here that these symptoms would speak to burnout as well. We've talked about the cognitive. Behavioral can be withdrawal, lack of motivation, very similar. Our emotional symptoms, we might be running the gamut of emotions throughout the course of the day, or we just shut down and feel nothing. Some people might lean into anxiety and be very reactive. Other people might feel a sense of hopelessness. And to share something that I find is very much, what's the word I'm looking for, comes up with both clinical and medical, is our worldview can shift and change depending on what we're exposed to. So for those of you that are looking at the, let's say, randomness, or be thinking about how is it that some people who maintain excellent personal health end up with this, or those of you working with children and you're looking at suffering and trying to make sense of that, sometimes our worldview changes. And I remember when I first started working with trauma, this was an area for me because I was listening to awful stories on a regular basis about how people have been very badly harmed, often by those that were responsible for protecting them, and then what that's done to their lives as a result. And I noticed that my worldview of mankind as a whole was shifting. And I'd like you all to consider the following question. This question comes from Brené Brown, my favorite social work researcher, and she asked the question, do you feel like people are doing the best they can given their current set of circumstances? And there's no right or wrong to that. Some of you will say yes, some of you will say no. Others might say, well, that's very dependent on the person and the situation. Too many contingencies. But have a think about, would you lean yes or no to that very general question? Because it gives you an indicator of your worldview of people as a whole. And it's something that we can be exploring, certainly with a therapist, but also for you, asking yourself those questions. Since working in the medical field, have my core beliefs, which is your views on yourself, other people, or how the world works, your core beliefs, have they shifted? Because we see this as a result of both burnout and certainly compassion fatigue. You can see here our physical symptoms. A lot of people see burnout as being physical, but you can see here compassion fatigue links to all of these areas. So it can be a combination. What's the difference if it presents in a very similar way? One stems from chronic workplace stress and job demands. Compassion fatigue is emotional exhaustion and prolonged exposure to patient suffering. Once again, using an example from my previous workplace. I was feeling quite tired and run down. I was finding that my sleep was affected. I was waking up in the middle of the night thinking about how I was going to help my clients. And I started listening to a sleep talk down and I was looking after my physical health and I felt like I was doing everything right. And I acknowledged the increased pressure. But there was a freeze frame moment in all of this. And a client, not one of mine, but they approached me in a treatment setting and said that their father was dying and they wanted to exit treatment. And I had a conversation with this client. I said everything in an appropriate, calm fashion. But as I walked away, I thought, I don't feel anything, like nothing. And that was a bit of a red flag for me because I can be quite an emotive person. And when you tell me something sad, I'm going to connect to that. Now, that doesn't mean I feel the same level of sadness and emotions that my clients experience, but it can be similar for the empathetic medical teams that might be listening to this. If you have a normal empathetic response and then you start to feel a little bit of nothing, this can also be a red flag that we need to be considering. Now, I'm going to read these 10 statements out to you, and I would like you all to keep a tally of how many of these apply to you, just in terms of a number. Statement number one, do you feel emotionally drained after working with patients? Two, have you noticed a decline in your ability to empathize with those in your care? Three, do you experience intrusive thoughts or distressing recollections related to patient cases? Four, have you avoided certain patients or medical situations due to emotional discomfort? Five, do you feel a sense of detachment or numbness when interacting with patients? Six, have you felt overwhelmed or cynical about your work in recent weeks? Seven, do you experience physical symptoms such as headaches, fatigue, gastro issues related to work stress? Eight, have you struggled with sleep disturbances, nightmares, or heightened anxiety related to your professional role? Nine, do you find it increasingly difficult to recover emotionally after challenging patient encounters? And the last one here, 10, have colleagues or loved ones express concern about changes in your mood or well-being? What is your score for the self-assessment? For those of you that are between the 0 to 3, low risk of compassion fatigue and burnout, but continue to do what you do in terms of self-care. 4 to 6, you've got a moderate risk, might be worthwhile implementing some additional strategies or reviewing your existing ones. 7 plus, you have a high risk. Now, when I say review your self-care, there's a lot of wonderful research that's been done on well-being in the state of the world. One is from Gallup. They do excellent well-being reports. And then a second one, I smile when I say this, is from Lululemon. For those of you that are not familiar with Lululemon, they make very expensive yoga pants, but they can also afford to commission an excellent 15 country, 16,000 people report on well-being. And what they've found is a lot of people feel stress at the result of having to keep up with their well-being. And for those of you who are thinking, I need to exercise, I need to eat well, I need to do all of this, except where do I find the time? And you feel more pressure. You are not alone. So they're two very good reports to be checking out. Gallup, Lululemon, 2024 well-being. You'll find them in Google. Because when I say looking at your self-care, that's wonderful, but what if you're working 60, 70 plus hours a week? You only have X amount of time. So in the next few slides, we're going to look at, after this, some pointers that you can take into your work if you identified with some of the higher scores for that last slide here. And I'd like you to think about, have you experienced some of the symptoms that we've been talking about? And have you recognized those? Because one area as well that I find my field has in common with medical is we think we know lots, and we do for sure. But sometimes I've noticed that working with doctors that have reached out for assistance clinically and also working with psychologists, some do not identify the signs in them, or they feel in some way they're immune because they have all the information. And it can be a mix of both. It can actually stop people from asking for help because they think, well, I have the answers. I'm going to incorporate some more exercise and push harder. Or they are not going to do these things because they feel like the rules don't apply to them. So the first number one big step in this is recognizing your symptoms. How do you know what a little bit, moderate amount, and high level of stress looks like for you? What are those physical symptoms? If I was a fly on the wall, what would I be noticing with you? Because we're not all the same. And it's really important that you're recognizing these types of symptoms. Step one. And then what can we do after that self-assessment? There's lots of research in and around mindfulness and breath control. What we also find is that our micro recovery moments, and these can be quick, structured responses to stress in the moment. And I'm going to go through a few of those. But the first one here that I'd like to point out is, what is your reaction directly after a reaction? So, for example, if you have had a heightened stress response, what do you then respond with? Because there are many different types of techniques that we can be using. I would suggest you try all of them and see which one works best for you. Our cyclic breathing, and I'd like you all to try this. Inhale through your nose, and then one more, completely filling your lungs up with air through the nose, and then exhale, sigh it out through the mouth. Research by Stanford University has demonstrated how this type of breathing can be very effective for regulating the nervous system. So you can do 5, 10 breaths. Sometimes if you do a lot of that breathing, it might make you feel a little dizzy. So sit down while doing that. But box breathing is a technique that one of my therapist friends, she works with the military in her country, and special forces learns box breathing. Visualize a box. Inhale, counting for 4, hold your breath, counting for 4, exhale, counting for 4, hold your breath, counting for 4. This can be quite helpful if you are experiencing anxiety symptoms such as tightening of the chest or tension in the upper body, because that kind of breathing is a little uncomfortable, puts a bit of pressure on the lung area and can release some of that tension. Our last one here is 5 to 6 breaths per minute. So we're really trying to slow down. And I think one of the elements here as well is exhaling for longer than you inhale, because this sends a message to the nervous system and the heart rate. And I do that actually while I'm walking on the treadmill. If I see my heart rate increase a little bit, I use that and I can see quite literally with my sports watch my heart rate minimizing. So we can do that in the moment for stress. Another key area here, and particularly for those of you that might be working in rural communities or in a different country and or city to where you originated from, you might not be as socially connected. Also, there was a beautiful piece of research. It's the longest running study of its kind done by Harvard University, and they asked young Harvard men back in the 1930s, what do you want in life? What are your goals? And being young Harvard men, they said things like money, power, fame, prestige, more money. And Harvard has tracked these men throughout the course of their life. And what they've seen is a direct correlation between levels of happiness and social connection. The men that were the most socially connected had higher levels of self-reported happiness, but they also had better physical health outcomes. The men who were socially isolated or in high conflict relationships had lower levels of both happiness and higher levels of diabetes, heart disease, and high blood pressure. And so I know that this slide and keeping connected is not going to be brand new information for some of you, but how do we then apply it to our own lives? What happens if you are away from your social connections? Either trying to establish new ones. Some of you might have strained relationships with family members. As I've lived and worked in a bunch of countries at this point, I'm very fond of expat.com and internations and meetup groups because I knew that it was really important, particularly when I was doing my PhD research in Asia, that I had people that I could lean into there because I'm close to my family, but they were back in Australia. So, for those of you that might have similar setups or situations occurring, how do you focus on this area? Because it will improve your stress levels. If you can leave an incredibly long and difficult shift and then go to a person that you love, you trust, you feel really safe with, and talk to them about it. They might not give you some amazing advice in how to take on the challenges of tomorrow, but just having them there to listen, to understand, and to love and support can make a world of difference to your potential for both compassion fatigue and burnout. We also have elements of workplace culture, as was mentioned in one of the earlier slides. Our physical health strategies and working with Fortune 500 globally, as I do, I absolutely love hearing about all of these different strategies that are being embedded into organizations. So, whether that is a focus on walking meetings, or whether it's a focus on having different types of talks and health benefits and giving away gym memberships as prizes. And I've seen lots of different strategies. And as your medical, if I say nutrition, sleep, and exercise are key, none of you are going to say, wow, that's groundbreaking information. But then how's your sleep? Is it a priority in your life? We also have those mental health strategies, and this can be helped by social connection. Not all roads lead to therapy, they certainly can, but we see that the ability to connect and belong is really powerful. So if you have those go-to people, they're going to be one of your best stress busting strategies. And also, when we look at other stress management strategies, workplaces that do bring meditation, mindfulness, yoga, tai chi, walking around the park, lots of different physical strategies, we know this helps. So maybe this is a conversation that you can be having with your teams. How can we maximize our productivity by embedding some of these strategies into our workplace as well as our home? Because I don't think it's fair to say, oh, so you're working 70 hours a week. Have you considered yoga? You know, are you able to do yoga at work? Are you able to roll out a yoga mat in between your patients and just have a nice little 5 minute breathing session, listen to something on YouTube? It doesn't have to be the most technical strategies, it can be simple. And I would recommend that you think about what has come out that might be helpful from this session, set some gentle phone alarms, embed reminders in your calendar, and please undertake it for a month before you review. Neuroscientists like to say that it takes a minimum of 1 month to make or break a habit. So please don't try some meditation a couple of times and think, well, that doesn't work. I'm still stressed. And give it a minute. And by a minute, I mean 1 month. Do it as much as you can and then review. Is this working? How is my overall level of stress? How are my physical symptoms? Am I reacting and responding more calmly in emotional settings, or my sleep? Review after a month and then see what you might like to tweak, support you might like to ask for. I think it's an ongoing process of learning. And that brings me to the end of the session. For those of you who would like some further information, I have written an academic article on this topic specifically for this conference, and you can find this and many more articles on my ResearchGate profile. So if that appeals as a way of doing a bit more of a deep dive into the neuroscience as well, please feel free to check that out. And it was lovely to talk to you all today, and I hope you got something helpful and useful out of today's session. Thanks so much, and bye for now.